welcome to another episode of Health Talk with Riva. I am your host, Riva, and I'm joined today by my co-host.
And this is Tech World Travels and Review, and we are here with another exciting podcast to discuss here on a topic that you may know someone that has experienced this year, or you currently know someone has experienced this year. We are going to get some answers here with Dr. Riva.
Yeah, so recently there was a lot of discussion in the medical community about a new blood test that helps to detect Alzheimer's disease. And I was excited about it. I came home, talked to Orlando about it, and he wasn't really sure. He saw eye to eye with me on that topic. So today we wanted to bring our discussion to you and share our views, and hopefully we can open some conversations for you as well.
Yeah, I think a lot of it is I just wasn't very informed or educated on the topic. So that's why I think this is a really good conversation to have here. And my first question here is, what is Alzheimer's? Just to get a foundation.
Yeah, Alzheimer's is an irreversible neurodegenerative disease of the brain, which means that over time, someone slowly loses some of their brain function. Specifically, there is memory loss, loss of ability to think, and ability to function and complete daily activities. So Alzheimer's is actually a condition that causes 60 to 70% of the cases of dementia.
Right. And since we're on this topic here, what is the difference with dementia and Alzheimer's? I sometimes use them interchangeably, so I'm not sure if I'm using it correctly.
So you might not be using it incorrectly because dementia actually is the umbrella term. So it just describes a group of symptoms. Those, as I mentioned, like the memory defects or like forgetfulness, and just like the loss of certain abilities to do daily tasks. So those are all considered dementia, but Alzheimer's itself is just one of the main causes of dementia.
So it's like a specific disease within dementia. The group. Yeah. Okay, yeah. Perfect. Makes sense. So moving on, what are some of the symptoms of someone that may have like Alzheimer?
That's a great question. So Alzheimer's, as I mentioned, it's very gradual. It's a slowly progressing disease. So the symptoms are usually split into like early onset, middle, and late dementia. So the early symptoms can be just disruptive memory changes. So someone just relying more heavily on a list of things that like some memos that reminds them of tasks that they might need to do, misplacing things, just generally forgetfulness, struggling to complete tasks that they usually are able to do. This could be just like following a simple recipe when you're cooking a dish that you've cooked a million times, getting confused with space or time, like the location you're in, what time of day it is, especially in the evenings and early in the mornings. Easily misplacing things because you've put it in a strange place. For instance, putting your car keys in the freezer, things like that. So those are usually some of the signs of early onset dementia. And in the middle phases, or as it progresses, those symptoms get a little bit worse. And when that starts happening, people start having behavioral changes and lots of like restlessness, because at that point they are having difficulty calling to term words, so their communication is a little bit harder. They have lots of more mood swings. They're paranoid about things, and then there's something we call sundowning that also happens, where they become very agitated, really anxious, very nervous, and they tend to wander mostly in the afternoons and in the morning. And of course, at that point, some folks, their family would realize that they need some more help, and there would be loss of independence. They won't be able to drive, things like that. And then in the late onset dementia, this is where communication is very, very difficult. They can completely become nonverbal, and there's just this physical decline that goes along with it, where people are unable to walk. They're not able to support themselves, even sometimes eat or swallow their own food. They actually become in a vegetative state, so sometimes these patients end up in a care facility or need to stay in their beds all day. and then there's just a very slow decline in those patients.
It's so devastating to hear, because that can really make you you feel for someone that's going through that kind of condition. And so, kind of moving on here with this topic, why should we care about something like Alzheimer right now?
Yeah, that's a good question. So globally, there's about 57 million people that live with dementia, and of that number, we estimate 60 to 70% of those people have Alzheimer's disease. So that is quite a large number of people that are going to slowly decline over time. Alzheimer's, as I mentioned, is not just a memory disorder, but it can also cause death, because as someone slowly declines in their health and their function, they can become more susceptible to pneumonias, bed sores, other types of infections, other factors that can lead to death. Also, additionally, in 2050, we expect that 1 in 3 people could have Alzheimer's. So not just dementia, but Alzheimer's, which is very, very important to note, because right now there is no cure for that. So it is something that we should be taking very seriously, and we should be, thinking about all of the new breakthrough therapies and advances about Alzheimer's.
That is scary to think of. In 2050, that spike in Alzheimer's is going to be very interesting to look forward to. Now that you mentioned something about cure, I saw the news and we had this discussion where it seems like these scientists are like really, really trying to like fight each other on the early detection of Alzheimer's. I think there was a news article where the scientists are not accepting this theory where Alzheimer's can be tested through blood. Can you like share more on that and help us understand what's happening here?
Yeah. So first, like, I'll take a step back and talk about the testing. So currently, the way that we diagnose Alzheimer's is in someone that starts to have these symptoms, we would do something called a spinal tap to look at the cerebrospinal fluid to detect certain proteins that are going to be present if you have Alzheimer's. We can also do something called a PET scan, which is a specialized type of CT scan where we also look for the accumulation of these proteins in the brain. And so what happens over time that causes this disease is these proteins build up in the brain. They starve the brain of nutrition and food, and those brain cells begin to die. And that is why someone loses function and it's not reversible. So the current testing usually is very expensive. Also, taking that cerebrospinal fluid, it costs a lot of money. You have to take time off of work. There's so many other factors, and so it's usually very difficult for the diagnosis to happen, and there's usually delays in getting someone diagnosed. A blood test, on the other hand, is usually something that can easily be rolled out to many, many people and would be cheaper to do. You wouldn't have to worry as much about your insurance covering that type of procedure. So what happens with the blood test is the FDA has actually approved this blood test because research has shown that the blood test has been very accurate at detecting these proteins in the blood. So basically, the blood test, what it will do is it looks for the two proteins and they calculate a ratio, and based on that, it will tell you if you have a positive or a negative test result. If you do have a positive test result, there needs to still be a confirmation diagnosis made through the cerebrospinal fluid, so you'd still need to do a lumbar puncture or a tap, or a PET scan. So if you have a positive result, doesn't necessarily 100% guarantee that you have Alzheimer's, because only the cerebrospinal fluid or the PET scan can confirm that. But also, if it is negative, it usually means that you don't have it. That's more of a definitive no. Okay? There are 20% of the cases that could potentially have an inconclusive test, but it could still be repeated because the efficacy of the test means it's 94% accurate. Yes, so now let's get to the controversy about it. Okay, so the first group of folks in the scientific community are looking at, the development of this new breakthrough testing as something wonderful, amazing. It allows us to scale up screening of dementia or folks that are presenting symptoms of dementia. We can confirm a diagnosis of Alzheimer's much earlier. We can get folks tested earlier or confirmation earlier for those people that might have Alzheimer's. And then also, we are thinking about the scalability and the cost. It would be cheaper for someone to get this test. Someone might be more open to doing a blood test versus doing a PET scan. We wouldn't have to worry as much about insurance coverages, things like that. So, as a researcher, I also believe, that this is a great option because we are still looking for a cure or for better treatment for Alzheimer's, and I think this would be a good way of using screening tools to allow us to get more trial participants to work on more research trials that maybe can lead to a breakthrough cure or treatment for Alzheimer's. So that is the first group of people. That's our opinions. And then the second group of people are more along the lines of, well, if there's no cure, then why are we doing the testing right now? Then you would just be living under this shadow of this really heavy diagnosis and taking every day as what if like tomorrow it gets worse. You would be constantly worried about something. And a lot of the times people are worrying about the ethicalness of the test because should we just screen everyone for it if there isn't a cure? Should we screen people and have this diagnosis even though some of the people that do test positive might not be confirmed to have this disease? So while you're waiting for that confirmation, you still are living in that state of panic and worry. So those were some of the arguments on the two opposite sides of the table. And I think they're both very valid arguments, and it really is a fine line for providers to determine when it is the right time to approach a patient about testing, and would it be in the best interest of that patient.
So to sum this up, kind of, so that we understand, so it's one group of like legacy folks who believe that when you test someone for something that you don't have cure for, it could create like an anxiety within the population, thinking that you may or may not have Alzheimer. We tested it, but we don't have cure for it, so people might not be living the true best self. And then there's the other side where there's the more modern view on this testing, where the belief is just test everyone. It's just better to test, know early, and then decide what your care is long term. Is that how you see this?
Yeah, because I mean there is actually some therapy out there for folks that do have very early onset dementia, and I feel like if we are able to get a very early diagnosis, you never know, maybe this medication can help. I know it's called Lecimnib. I might be saying it incorrectly, but it is actually a subcutaneous injection that people can take at home. It helps to slow the progression of the disease. It's not a cure, but again, it's only for people that have early onset dementia and Alzheimer's. So maybe having the diagnosis earlier can help in research so that we have better drugs in the future and maybe even a cure.
Right, and I guess that begs to argue, like, as a layperson, the decision is something you have to make. Is, do you want to get tested early, and through the blood test process to know if you have dementia or not, or do you wait for the signs to show up and then do all the exhaustive procedure, the spinal tap, etc., what you describe, to have like the real confirmed diagnosis they have dementia? I think that's where the public is kind of have to decide, right?
Yeah, Yeah, so usually providers will only recommend this test when someone is already exhibiting certain risk factors and certain signs and symptoms of dementia. So if they're starting to exhibit those early signs of dementia, this is a woman that has maybe other comorbidities, heart problems, diabetes, other things, and they're over the age of 65, and starting to show these symptoms of early onset Alzheimer's or dementia, they might actually recommend the test. So it's not that we would test everyone whether or not you have the disease. It would be in, with medical, with their medical choice, like decisions from the physicians, as well as the symptoms that the patient is exhibiting.
And I think why Alzheimer's is such a loaded type of disease is the ripple effect that it has on the family. Typically, if you do have Alzheimer's, from what I know from past relative, is you kind of have to create an environment for that individual where they don't harm themselves or harm someone around them, because they lose that existing memory of who they are and what the surrounding is. I've heard cases where someone with Alzheimer will take a train and end up in a completely different state. And you know how traumatic that is when your loved ones is out there wandering in a different state and they have no recollection or no memory of where they should be. So that's why it's such a painful and traumatic experience for folks with Alzheimer, that the family has to make a lot of adjustments to care for those individuals. We are coming close to the conclusion here. Is there any other details, fun fact you want to share about Alzheimer's?
Yeah, I think you hit on all of the main points that I felt were important to me. Just seeing someone that you love losing all of their functions over time is something very, very difficult. And I'm hopeful that in the future that, with all of these new testing, that maybe in the future we can slow this down. There's so many other factors in the world right now that will increase our chances when we do get older for us to have possibly Alzheimer's, even just like pollution and environmental factors. So, with all of those things in mind, I do hope that we can have more of these conversations where we're sharing new innovative treatments for Alzheimer's. And if you have any questions about the testing, please feel free to leave me a comment or send me a message, and I'll happily provide more information.
All right, and that being said, make sure you subscribe, share this podcast out to anyone you know that is struggling with this disease or have someone else that's in their family struggling with disease. And we will see you on the next podcast. Bye for now.